Today's topic is common problems during pregnancy. Though pregnancy is a physiological process, it's not a disease, but due to certain hormonal changes and emotional changes in the body, there are common problems which are not a disease, but they do happen. So I'm going to talk about these today, and I will be sharing my screen. Can you see my screen?
Yes, ma'am.
So my topic is common problems during pregnancy. These are the common discomforts of pregnancy. I have listed here: nausea, indigestion, breast tenderness, frequent urination, headaches, backache, sweating. So these are the common problems, and then I will go one by one. And as I previously said, these are not diseases, these are common problems. First is urinary frequency. During pregnancy, when the uterus grows and the uterus presses on the urinary bladder, that leads to increased urinary frequency. So that is normal. And how to tackle that? Decrease fluid intake at night. Because if the mother has to get up every now and then during the night, she'll be much disturbed. So during the night after 5 p.m., the fluid intake should be decreased. And during the day, she should maintain fluid intake so that she does not get dehydrated. And void when feel the urge. Fatigue and sleep difficulty. Because of the hormonal changes, there is fatigue and there is extra burden on the mother. So what is required is she should rest frequently during her daytime schedules. She should take some rest, lie down in between her work, and she should retire to bed early so that she has a sound sleep of 8 to 9 hours. Nausea and vomiting. Nausea is a very frequent problem during the first 3 months of pregnancy, or you can say first trimester of pregnancy. It may or may not be associated with vomiting. So what should be done to avoid this? So we have seen, and you all must have also experienced that there are certain foods or there are certain smells which can, aggravate the nausea. So mother has to identify what foods and smells exacerbate her nausea, then she can avoid those foods and eat dry crackers or toast before rising in the morning. Because in the morning, the nausea is the maximum. That is why it is called morning sickness. So it's better to, when she gets up from the bed, before getting up from the bed, she eats some dry toast or cracker and lie down for some time, and then she gets up. So that will help in mitigating nausea. And the next is eat small frequent meals. So if the mother is empty stomach, the nausea will be more. And if she has overeating, again the nausea will be more, nausea and vomiting. So she has to eat small frequent meals so that her stomach is, full. Then avoid sudden movements, get out of bed slowly, breathe fresh air to help relieve nausea. And there are certain things, like certain people feel that chewing ginger also helps. So one can, see for oneself what things increase nausea, vomiting, and what things decrease nausea, vomiting. Heartburn. Heartburn, it happens because of the hormones of pregnancy. The valve of the stomach, loosens up. So what happens when the mother eats the food? the food can go into the food pipe. When the food goes into the food pipe, that can cause heartburn. So what are the relief measures for that? One is eat small, more frequent meals, because if you eat a large meal, that will definitely go to the food pipe. And you can use antacids if required. Avoid overeating and spicy foods. So if you eat more than your stomach can take, that will go into the food pipe, because normally the valve closes between the food pipe and the stomach. So it will not allow the food to go into the food pipe. But during pregnancy, it is loose, so it can go. So that is why it is required to eat small and frequent meals. Then you can take cold milk or fresh curd. That can also reduce the heartburn. Constipation is also a very common problem. Again, it is because of the hormonal changes, because all the hormones of pregnancy, relax the body, so everything is relaxed. So to avoid constipation, one is maintain regular bowel habits so that the stools don't get hard, and increase fiber in diet. So fiber, you all must be knowing, we have fiber in fruits, vegetables, whole grains, and salads, all these. So the mother should eat high fiber diet so that she does not get constipated. And increase fluids so that the stool does not get hard. When it gets hard, dry, then again there is a chance of constipation. Find iron preparation that is least constipating. During pregnancy, mothers are prescribed iron supplementation because iron in the diet may not be sufficient for both mother and baby. So normally iron supplements are given. Then iron supplements may also cause constipation and also diarrhea sometimes. So it is better if one gets constipated, so one has to try different preparations that which one causes less constipation. And one can also, eat iron-rich foods and cooking in iron pots. That will help increase the iron intake without constipation. Hemorrhoids or piles. This means that bleeding from rectum. So that can also, this is also because everything is relaxed, so there is increased blood circulation. And if there is constipation, then mother can bleed from the rectum. So again, the relief measures are maintain regular bowel habits so that she does not get constipated. If the stool softeners are prescribed, one can take it, which the stool softeners have to be mild. And if there is pain, then some topical anesthetic ointment can be applied there. Dependent edema. You can see in this picture, the mother has swollen ankles. So, sorry. This also happens where if the mother is standing for a long time, then this swelling of the feet and ankles can happen. To avoid that, excuse me, please. To avoid the edema, she should avoid standing for long periods. And when she's sitting, she can sit in this position. See, she's sitting on a chair and her feet are on the stool. So she has raised her legs. So that will, help in reducing the edema. And salt intake should also be reduced because more salt will lead to more edema. So this is the measures she can take. Excessive vaginal discharge. This is also a normal thing during pregnancy because of the increased blood supply. So there are more vaginal secretions which are normal. But if these secretions are, foul smelling, or they are giving itching, so they are not normal, then mother has to contact her obstetrician for treatment. But if they are just increased discharge without any symptoms, so that can be taken as normal. And to avoid that, she has to take a daily bath to clean herself, and wear a cotton underwear so that her skin breathes, and keep the area dry. And if it is more excessive, then she can, change the panty 2 or 3 times in a day. But the area should be kept clean and dry to avoid further infection. Backache. Backache is also a very, very common symptom, problem of pregnancy, because all the ligaments of the spine, get loose during pregnancy, and then there's weight of the baby which mother is carrying. So that can lead to backache. It's not a disease, it's normal. So what she should do? She should wear shoes with low heels. High heels can again aggravate backache. So she should wear shoes, very comfortable shoes with low heels. Shoes is the main thing which can, avoid backaches. And she can use firm mattress. The mattress should not be soggy so that her back, just is not straight. The should be firm so that her back is straight. And then she can perform some pelvic tilting exercises. So tilting exercises are like she stands against the wall with her back against the wall, and she tries to pull her navel, belly button towards the wall, and hold her breath for 4 seconds and release. And do it 10 times. These exercises also help in the backache. Leg cramps. Leg cramps are also very common during pregnancy. So how to, treat it is like when there's suppose there is leg cramp in the right leg, you extend the leg, then you flex the foot like this and do like this. This will help in alleviating the cramp. And preventive is elevate lower legs frequently, apply heat to muscles, and take a good nutritious diet. So this is all about the common problems during pregnancy. And I would like to take questions at the end of my presentation. But I would also like to introduce you to I Decide. This is a portal. I will share another screen with you. This is a I Decide. Sorry. Yashika, can you share?
Yes, ma'am. Yes, I'm doing that, ma'am. Can you see?
This is a web portal we have made to help pregnant couples, rather moms and dads, to facilitate breastfeeding after the delivery of the baby, immediately after the delivery of the baby, and help in decision making. So I will just run this video of 1 minute, which will just
We never say it out loud, but being a mother is scary. Eat this, not that. Why you are doing this, not that. So many opinions, so many suggestions. We all want best for them. But who gets to decide what is best for our child? Well, for my baby, I decide. This new portal by BPNI keeps me informed and up to date with everything that I need to know about feeding my baby. When to start feeding, how to hold my baby, and so much more. All the information at one place to know how to feed my child. And when I know the correct scientific information, then I have the power to make the best decision for my child. Cause for my baby, I decide.
So this was in the nutshell telling about I decide.
Can you see my screen, ma'am?
No, now I will start sharing my screen, right?
Yes, yes. Okay, ma'am.
So taking this further, yeah, one slide from the problems I think is left. I don't know how. Faintness. The fainting is also a very common problem during pregnancy, because sometimes when one suddenly gets up from the bed, the pressure drops. So rise slowly from sitting to standing. Evaluate hemoglobin. So if you are anemic, again you can have fainting spells, and avoid hot environment, so that will lead to dehydration. So this I Decide portal, it has a 3-step empowerment of the couples. Step 1 is knowledge during pregnancy, where we have videos and reading material to help the parents gain knowledge. And step 2 is making an informed decision. After going through all the knowledge, they make a decision what they want to feed their baby. And step 3 is they tell their doctor what they want to do, and they inform the doctor. So what are the educative materials are? List of modules are benefits of breastfeeding. These are 2 to 3 minutes videos each, which have been very beautifully prepared, and it explains very beautifully benefits of breastfeeding. I will not go into the details of all that. Early initiation of breastfeeding and skin to skin contact, positioning and attachment, safety preparation of artificial feeding, manual expression of breast milk with hand, not with pump, how to be successful at breastfeeding. These are 6 videos of 2 to 3 minutes each. And we have this 50 pages booklet of reading material. This is a breastfeeding and complementary feeding guide for the parents, and this is available in 10 languages. This can be downloaded from the website. After the parents, the couple decides, gains the knowledge, they decide what they want to feed the baby. A certificate is generated like this. Here, my feeding decision, I'm well informed. So it's an informed decision, because we all know that during delivery sometimes formula is forced upon the parents, because they are so vulnerable at that time, and if they are not fully prepared, so it is forced during the hospital stay. But if you are already prepared, you know that it is well, I am well informed, have decided to breastfeed my newborn immediately after birth and give nothing except breast milk during hospital stay. So this certificate is downloaded, and this can be shared with the consulting doctor. And then you can also ask for certain facilities, like if you decided to breastfeed, you can ask for a companion in the labor room who will assist in early initiation and things like that. So once you go into the website, you can, you can just go through all that and you can get yourself updated on all that. So that is all about I Decide. And I would also like to announce that we have next session. We are going to have these sessions at second Tuesday of every month between 3 to 4. So next will be on 8th March, and that topic will be vaccination during pregnancy. Please look for our message and try to log in and try to, participate. And also try, if you like, you can also log into ID site and see all the videos. And thank you for your kind attention.